I got a question for you. Does coughing, laughing, or sneezing make you, pee a little? Yeah, well, urinary incontinence, it's extremely common in both women and men, but we really don't talk about it because it's kind of embarrassing. And I'm going to talk about everything, so let's talk about this. Because the good news is you can do something about it. Here to discuss treatment options is Dr. Karny Jacoby, urogynecologist at Overlake Medical Centers and Clinics. Thank you for being here.
Thank you for having me.
Okay, let's talk about what urinary incontinence is. I think a lot of us think, oh, it's from when we had kids or this or that, but can you just kind of tell us what's going on?
Right. It's defined as the involuntary loss of urine, and also in some cases people have accidental bowel leakage too. So it's the involuntary loss of when you're doing different maneuvers or if you have a sudden urgency to go.
Yeah. I have many friends, both who have had babies and have not, but in their 40s who are saying, this is happening to me. Yeah. Who is at risk?
Well, more women than men, but both genders. And so after having a baby, when the tissues get stretched out, as you go through menopause and there's hormonal changes, as you age with loss of strength. So those are kind of the main risk factors. Other risk factors are obesity, smoking, and things that affect the actual tissue quality, diabetes as well, metabolic syndromes.
Okay. Let's take a step deeper and talk about some of the common urinary incontinence disorders.
So the one you alluded to is what we call stress urinary incontinence, and what that results from the involuntary loss of urine from an increased abdominal pressure. So for example, if you're going to cough or sneeze or hit a tennis ball or a golf ball or something, or step off a curb, then you might have an increase in your abdominal pressure, and then that could result in involuntary loss of urine. And that has to do with the sphincter being weak.
Okay. So let's talk about treatment options for stress incontinence specifically, and that was kind of related to that, right?
Yeah.
So you can do physical therapy for this?
Yeah, there's, and we send people to physical therapy over at Overlake all the time. They're specialized, so they have a physical therapy degree plus an extra added certification for women's health.
Yeah.
And what they do is they put you in a private room and oftentimes hook you up to a biofeedback machine and help you learn how to access those pelvic floor muscles so that you can voluntarily squeeze before you sneeze or do an activity.
Oh, that's cool.
Yeah.
Muscle strengthening.
Yeah. So if you can't access those muscles, then the physical therapist or other therapist will add electrical stimulation or e-stim and help kind of engage those muscles for you.
And then what about actual devices?
Right. So there is an over-the-counter device called the Impressa device and other incontinence pessaries that you would put into your vagina. And that would kind of hold the urethra shut, if you will, while you're engaging in these activities. But you have to take it out, and so for a lot of women who are super active, it's kind of a hassle factor. But it can be a temporary thing if you only leak if you're horseback riding or very
So
rare.
if there's something you're like, all right, I don't want to deal with this, so I can run to the store and get it. Okay, that's good.
Yeah.
What is bulking agent?
So bulking agent is kind of like filler from, imagine the filler from the cosmetic world.
Yeah.
And it's like caulking, if you will.
Yes, I'm here for that.
So we want to give you more pucker power down there, so we increase your sphincter strength, if you will.
Mid-urethral sling.
Right, so that's a small piece of mesh that supports the urethra and doesn't allow it to fall down.
So that actually can lift it.
Exactly.
And that's a surgery.
It's a surgery, yeah.
So what are some treatments for overactive bladder or urge incontinence? I know that's separate from the stress.
So the urge incontinence is really more where the bladder's squeezing without its owner's permission, right? So you feel like you've got the key in the door.
I feel like it's happening to me right now, actually.
Yeah.
As we're talking about it, I know.
Anxiety definitely can provoke that. For sure.
Fine, by the way.
Yeah. Okay, good to know.
So behavioral modifications and medications.
So, exactly. So with that, we do PT as well, but also behavioral modifications is like try not to drink so much fluid or avoid foods that are high in acid like coffee and orange juice and things like that are going to irritate the bladder, or alcohol.
Yeah. Medications?
So there's medications for overactive bladder, specifically FDA approved for that. There's several different classes of medications, and sadly only about a third of patients stay on the medications because they do have lots of side effects. But in some cases, They work fine, and people like being on them.
Well, that's good. You mentioned the filler, the caulking agent, but in that vein, the bladder Botox injections.
Yes.
What is this?
So we do little shots of Botox in the bladder, and what that does is it helps calm down the bladder muscle so it doesn't squeeze without its owner's permission.
Okay.
So similar in cosmetic Botox, it has it lasts for a certain amount of time, maybe 3 to 12 months, and you have to repeat the injections.
Okay. All right. This one I'm going to try to pronounce, but you're going to correct me. Interstim and anoxys.
Axonics.
Axonics, yes. What is this?
That goes under the heading neuromodulation. So basically,
neuromodulation.
Yeah, it's a cool word. And basically what we're trying to do is calm down the nerves.
Okay.
So if you imagine like a pacemaker for the heart, this is a pacemaker for the bladder and the bowel, and it's actually FDA approved for overactive bladder and accidental bowel leakage.
Yeah.
And so it's a small implant that goes in your upper buttock area, the battery. It's a battery and a computer. And then there's a little lead or wire that goes into the peripheral nerves. And we have lots of programmings and settings to help calm down the bladder. It's so cool.
That's incredible.
Yes.
I have to say, I think that when this happens to us, you think maybe you've heard of one thing or one friend had something done. And I'm just so glad that you just explained all these things with us. I feel so much more comfortable talking to you about this.
Well, I think the important thing to know is that wherever you are on that pathway, there's like lots of options. And, at Overlake and our pelvic health, providers, we just kind of find out what you want to do and kind of tailor the treatment to what's comfortable for you.
That's great. Thank you so much. And if you all want to learn more about pelvic health and treatments at Overlake Medical Center and clinics, just visit the website on your screen. Go check it out. Go talk to Dr. Karny.
This portion of New Day Northwest is sponsored by Overlake Medical Center.